Hey, this is Paul again from the Smarttherapist, and we've been talking in this video series about the different kinds of practice models that are out there. In this video, we're going to talk about the clinical practice model. Now, if you remember, the three main ingredients for any successful counseling practice is being able to do good therapy, being able to generate referrals, and being able to handle the back end business side of things. When all three of these things work well, a practice will survive. Now, in the clinical practice, you're going to be focusing most of your energy as a counselor in only one of these areas, and that is this area right here. 95% of your time and effort is going to be spent doing therapy. That's because the clinic takes care of these two main areas here: their reputation and their experience and their name generates the referrals, and they usually have a staff to handle the business sides of things. But as an employee working for this organization, this clinic, you don't have to be dealing with any of the business stuff, and you don't have to be dealing with any of the referral stuff. You get to just focus on the therapeutic sides of things. Now, the nice part about just dealing with the therapeutic side of things is that you get to grow and get lots of experience practicing your therapeutic skills. This is actually an ideal setting for people who are either interns or needing to get their hours or learning a skill set around the therapeutic stuff. So this way they're only focusing on this. But as an employee, you get also to get typically some sort of supervision, vision, or you get some sort of collaboration, because there are other staff people that you can talk to and ask and get help, and there's accountability and all those things. So you're actually playing with kind of a safety net in a clinical setting, and that works really, really well for a lot of people. Now, the cost, unfortunately, for working in a clinic, there might not be cons if you only want to work on your therapeutic skill set, but when you're working in a clinic, you give up a lot of control. Even though you get a lot of experience seeing a lot of people, you also don't get to choose who you get to see. You have to work with pretty much whoever they give you, and sometimes you might not get the best fit. So you have to give up some of that control. You also tend to work the hours that they tell you that you have to work, and sometimes those hours aren't always the most fun. So you have a lot less control over kind of just the culture and the environment. The other thing is a lot of people like these things because they provide a sense of stability and security, but security is actually just a perception, because you're actually giving up that control to the clinic, and they are handling the success of the business by doing these two things well. But if they don't do that well, if for some reason the clinic itself folds or comes into troubles, then your job, because you're an employee, you end up losing your job, and you don't really have any say over making the practice get better. Finally, probably one of the downsides of working in a clinic is, we'll call it compensation. Because you are an employee, you are only getting a small percentage of the therapy fee that they are charging. The rest of the money goes towards building up that reputation, maintaining the business, and paying other people, the staff who are doing the business side of the organization. Your compensation tends not to be as great as it would be if you were in private practice or if you were collaborating with some other people. Now, these are the kind of the downsides, and there's lots of good things about clinical practice. If this is the model that works best for you, there's many organizations that will be glad to talk to you and want some really good people to bring on staff and to help them out. Give it a try.